despite the fact that fewer patients in the early palliative care group than in the standard group received aggressive end-of-life care, survival was longer, from 8.9 months to 11.6 months. Now, we just went through a couple of days of oncology drugs, and I don't know, Binay may be able to tell me if you had a drug that showed a survival improvement of 3 months, that's a pretty good intervention, correct, for certain situations.
And that it costs hundreds of thousands of dollars.
Correct. Yes.
Still has us a lot of benefit in stage 4 cancer.
Yeah. So pretty impressive how this one thing, and that is really what sparked palliative care as a specialty, and this was the landmark study. So Jennifer Temmel in our world is a very important person. So then this is what we refer to as what the recommendations are: inpatients and outpatients with advanced cancer. And my question was stage 4, which Binay may be able to explain more in more detail, advanced versus stage 4. I prefer to use the term advanced cancer. It gives you a little bit of wiggle room to be able to say this person, yes, they have stage 3, but they've had some complications. They have bad socioeconomic standing, other things that contribute to their suffering. So it's helpful to have the palliative care team involved. So it gives you a little bit. But you can read that there. But early in the course, and the recommendation is within 8 weeks usually of their diagnosis. As many of you know, and that see patients that have been recently diagnosed, they don't process things very quickly. They're stunned, basically. It's kind of how I like to put it. They're just not sure what to do. And so getting the team in there and helping them process all of that and go through their decision-making process, very important, and obviously leads to this recommendation based on the study that we've gone over. So tips. This is one of the hardest ones that you mentioned. There's lots and lots of tools out there. We like to use the terms. It's a supportive care team. It's a group of individuals. This is where I would love to hear some thoughts. Some of the others that have had experience explaining this. So it's just an added layer of support for patients and their families with advanced or chronic medical illness. It's a supportive care team. One of our sister hospital in Boise, they just call it supportive oncology. That's the name of it. They don't call it palliative care. They have avoided the confusion that goes along with hospice and palliative care and the difference between the two. An added layer of support, a symptom management team, a holistic approach, and I like those because you can see all the domains of care, and I believe, and I've never been trained as a nurse, and you can educate me, but nurses have a much more holistic approach to the patient from my understanding. At least that's what I see, and that's what I'm told by the nurses that I work with. The training is much more comprehensive in their approach to patients suffering. So any other suggestions on that? Does anybody feel like they're really good at this and they've successfully explained palliative care to people and want to share with the group? Go ahead.
I don't know if I'd cater being really successful or expert, but one of the ways that we were able to talk to physicians was really to emphasize the symptom management portion, because a lot of times, whether it's a primary care or even sometimes oncology, they weren't always the expert in regards to pain management, sleep, because sleep is an area that's often turfed back to the primary care, and the primary care goes, well, I don't know
Yes.